Good afternoon. Welcome again. I'm Ashley Setbin, she, her, hers from City Match, the Education Training Manager. We welcome you to today's Learning Network webinar with Dr. Caroline Hoffman, and I am going to be on for technical assistance and help, but I'll pass along to Carol to introduce our speakers so we can get started.
Hi, I'm Carol Gilbert, and I'm just here to introduce Caroline Hoffman, who now works at the Rhode Island Health Department. She spent nearly a decade in the field of public relations, working at agencies in New York City, and specialized in communicating FDA approvals and clinical trial data, building patient engagement programs, and in health crisis and issues preparedness. So she learned how to translate complex medical science and data into meaningful information for public health people. And she was introduced to the field of public health. She went on to get a master's in public health and then is currently the environmental health communications manager at the Rhode Island Public Health Department. And her work focuses on helping subject matter experts create and disseminate meaningful communications materials with calls to action. So action is an important part of communication. At the Rhode Island Department of Health, she works with a lot of different programs and centers, including the Environmental Public Health Tracking Program. You'll see some examples of that, and Climate Change and Health Program, and the Lead Poisoning Prevention Programs. We're also going to have Caroline as a presenter for a pre-conference training on communicating population-based data for decision-making. And this is kind of focused on communicating data to those multi-sector groups that we all have working on complicated health problems who need to have some data fed to them that they can understand to help them make the best decisions. So check out our conference webpage and sign up for that one if you're interested in that topic. And I will let Caroline proceed.
Great.
Thank you
Thanks,
for being with
Carol.
us.
Thank you. Well, I'm really excited to be here today to share a little bit about what I've learned about communicating data throughout the course of my career. As Carol said, I've spent over a decade as a health communicator, starting my career in New York City. Some examples of some of the communications products that I've developed in the patient advocacy and engagement programs. And through the work on the health crisis and issues team that I was on, I was really introduced to the field of public health by working with the HIV community and during the emergence of the Zika virus. So that led me to get my Master's of Public Health, graduating in the summer of 2021 from the Columbia University School of Public Health. And during my MPH program, I was able to build on my own data skills. This is always the point in time where I like to clarify that I am not a data analyst, not an epidemiologist. I am a communicator that really enjoys working with data. And as Carol mentioned, I currently work at the Rhode Island Department of Health. I've been here for about 3 years. And again, some examples of the types of products that I have produced and worked on. And so I'm, again, really excited to be here today. We're going to cover best practices for data visualizations, some tips for communicating and storytelling with data, and I'll have examples throughout the presentation. We're going to mostly scratch the surface on these topics since we only have an hour, but I hope that you find it interesting and helpful. So first up, why communicate with data? I believe that communication is a strategic public health intervention. And the good news is that anybody can improve their communication skills. Communicating with data, I believe, takes practice and time and repetition. But when it's done well, communicating with data empowers our audience to take an action or make a decision that will protect their health. It can help build their understanding and establish your organization as a trusted source of information. At the same time, if data is not communicated well, it can help have people lose trust in your organization. So it's really important that we're communicating data clearly. So this is a high-level overview of some of the best practices that I have found when it comes to creating data visualizations and to storytelling with data. And the first is that your data visualization needs to be complete. I think one of the most common missing elements is not having a clear denominator. And without the denominator, the data is really hard to interpret and understand. The other key thing I look for is to make sure the visualization has enough information so that it's understandable if it was taken out of whatever context you created in and put it on its own. So if somebody were to take a photo of your slides or a screen cap or copy and paste the image from the report, does your visualization stand alone and make sense? I also think good visualizations and good data storytelling need context. We can't rely on the visualization to tell the entire story itself, and by providing context, we help create meaning for the viewer. We also, using plain language can help explain key findings in a data visualization in a way that everyone can understand, and we'll get into that a little bit more later in the presentation. And ideally, your data visualization and story should be actionable. We want to answer the "so what now" question that someone might be asking after they look at your visualization. And this is called a call to action, and it again can empower our audience to do something as a result. And last, I always like to include a reminder that in public health, our data and our numbers represent people. I think we've seen recently more than ever that health is a very personal and sensitive topic. And when we're communicating about public health data, we're communicating about real people and the real issues that impact their health. So it requires an extra lens of care and consideration when we're crafting materials and messaging. I also wanted to note that we need to plan for accessibility when we're creating data visualizations from the beginning. It can be a little difficult with data visualization platforms. They're not always set up to be accessible, but a couple of things to think about are if you anticipate the audience will be viewing your data visualization from a mobile device, if your visualization will need to be translated and how you'll go about creating that translated version, if the platform you're using will be friendly for a screen reader, if there's the option to include image descriptions, and making sure that any color palette you're using is colorblind friendly. And I like to share the story that my partner is colorblind, and we do a lot of training runs together, and we wear the same smartwatch. We use the same app that comes with the smartwatch, and we both find the data really interesting. So on the screen, you can see that there's two versions of a cadence graph, and the cadence is the number of steps you're taking per minute. His cadence graph is on the top and mine is on the bottom. And mine is a different color because I was beta testing the new version of the app. And so when we were comparing the screens to each other, he commented that the new version had so many more colors and he really liked that feature. Well, if you're not red-green colorblind, you can actually see that both versions have 3 different colors, but the new beta app was made to be colorblind friendly. Now, this is a totally innocuous example. It doesn't really make a difference in his life, but it just goes to point out that when we don't design for accessibility intentionally, we're going to miss it. So make sure that you include that from the start when you're making your plans for data visualizations. So some quick tips for data visualizations. Again, really important to make it clear that what your denominator is and make sure that it's included. Make sure that your visualization has all of the information it would need to be interpreted on its own. So this would include the axes and the scales, making sure there's clear labels for information without being too distracting, making sure that if you're using color coding or icons, that there's a key to interpret them. And of course, making sure that our data is accurate and transparent, because this, again, helps to build trust in the organization. And it's really important to consider how to make the design as simple as possible. Your data visualization can't do everything, much like we can't do everything. So it's really good to focus on a single topic or a single message. If we're trying to communicate too much in one visualization, it gets really difficult to interpret. So if you find yourself using too many colors or shapes or icons to try to communicate the information, consider breaking it up into multiple visualizations. We want data visualizations to be designed to be as easy to understand as possible. And the more colors and shapes that we use in the visualization, the more effort it requires for us to interpret them. So this is an example of a visualization I saw in a recent presentation. And if you'd like, you can enter in the chat based on what you know about data visualizations or what we've talked about already this afternoon, a couple of ways that this data visualization could be improved. A couple of positives: they have a very clear denominator and it's broken out for each of the different categories. They're using a bar chart, so it's pretty easy to interpret. They have a clear description of what is being presented and a year, which is great. But there's no key. We can't see and figure out what the different color coding means. And I saw this presented in actually 2 different presentations, and still I'm not sure what the different color coding means. Additionally, the light green color and that pink coral color, I would be concerned might be difficult for someone who's red-green colorblind to see the difference in. Now they are broken up by that dark green, but again, it just makes it a little bit harder to interpret. And if we're looking really closely at the right-hand side of the visualization, it looks like those scale bars aren't quite lining up. So it's not clear, because there's no scale labels, if this is adding up to 100%, if we're being shown numbers. It's just a little bit difficult to confidently interpret the data. And this is an example of how changes to the axes can skew the data. So it's the same data points that are being presented, but the axis has changed. And on the left-hand side, it looks like a really significant difference between the 2 data points. But on the right-hand side, where the full scale from 0 to 100% is shown, it's a little bit more moderate. So again, that's just to emphasize the importance of being accurate and transparent and including that full scale bar. So over the course of my career, I have kind of come up with a process for working on developing and reviewing data visualizations that works for me. This is by no means a hard and fast rule, but I think it's a pretty solid approach. So the first step is to determine your topic and audience. Then we want to define the scope of the visualization so that you have a way to know what kind of data should be included and what might be left out. You should also define your audience's needs and let that also drive the scope. Then I recommend assembling a cross-functional team. I always like to work in a team for a couple of reasons. Again, first, I'm not a data expert, and in many cases, I'm not the subject matter expert. So having those other viewpoints helps to create really solid data visualizations. I think working in a team can also help overcome some of our personal biases, and we all look at things from a different lens. So I think we just create better products when working on a team. The next step is to develop the visualization, review it with the team, and revise and rinse and repeat through this cycle. Once we have a pretty solid data visualization, when it's possible, I recommend bringing it to the impacted community to provide input. This, again, will help you see where your team's personal biases may have impacted how the data visualization was created. It can help you find any areas that might be a little bit confusing in the data visualization, and they can provide input on the way that your data and message are framed. It's a really helpful way to get community buy-in before you take something into the market. Then, once your visualization is ready, it's time to publish and promote. And as part of that step, I try to anticipate the questions that we might be asked once the data visualization goes live. This is from my background in crisis communications. I always would rather be prepared. So oftentimes I'm actually physically writing the answers to the questions that we think we might get asked. This is also a really helpful step to see if we might have missed anything, and sometimes we'll make a final tweak to clarify the visualization before it goes live. So diving into this a little bit further on identifying the audience. There are many different audiences in public health, and there are some examples of what those audiences might be on the screen. And our different audiences have different backgrounds and different needs. So clearly defining an audience and getting really specific about their needs and their background to the degree possible can be really important. especially considering the fact that according to the National Literacy Institute, over half of US adults have a 6th grade reading level. It's really important to consider who you're talking to, what the information we know about them is, what their reading level is, what their familiarity with the topic is, and let that define some of what you're doing with the content, and really taking into consideration what their information needs are. So once you have your audience identified, we can actually create a visualization that is specific to their needs. So working with the lead poisoning prevention program, we detect lead poisoning by measuring blood lead levels, but we also try to prevent lead exposure by addressing hazards in the home. And so we really work on communicating with the landlord and homeowner audience, as well as the individuals. And we identified for the landlord that the most important questions or information that we provide to them is to establish that lead is actually very common in rental homes, and to provide information on how they can find out if their properties are safe. So we provided some data points to demonstrate how common lead is, and the information about how to have a lead inspector come check your home. For the individual, we determined that they really wanted to know if their personal house is safe and if there was anything that they could do. So we developed a graphic to provide them with some information about programs that are available that have funding to remediate lead hazards. So we have 2 different audiences with 2 different needs and 2 different graphics and sets of messages. And so once you know what you want to talk about and know your audience and their needs, you want to choose the visual that best tells your stories. Sometimes a bar chart or a pie chart aren't the best way to deliver the message. So the visuals on the slide are 2 ways of presenting the same statistic. On the left-hand side, we have the pie chart that says 7% of children entering kindergarten in Rhode Island in 2019 had lead in their body. But 7% is kind of a tricky statistic to understand. It's not as easy as the 10%, which most people know is 1 in 10. It doesn't sound like very many, and we probably aren't going to feel a very high sense of urgency behind that number. But when we use a pictograph or the infographic style visual and use 1 in 14 children, all of a sudden you start to picture a kindergarten class and how many kids that might be impacted. So sometimes using a pictograph like this can center the child or the person who's impacted in the message and make it more meaningful. I will give a quick shout out that bar charts are fantastic data visualization tools. They are pretty easy to create in a way that is easy to understand. Many people are familiar with looking at bar charts, so they'll have an easier time interpreting the data. So they can be a great option. Maps are also a data-rich visualization. So on the screen is a model of the urban heat island effect in Providence, Rhode Island. In 2020, we did a heat mapping exercise. And what I love about this map is how clearly it shows the 12-degree temperature difference across the city. And it would be one thing for me to tell you that there's a 12-degree temperature difference at the same time of day across Providence. But it's another thing to see how close some of those neighborhoods are and how vastly they're experiencing that difference in heat. It really illustrates that inequity, that heat is not felt the same way across the city. So again, just something to consider. And then I also wanted to talk about, I think when we're interested in data ourselves, like I am, it's very easy to get caught up in the nuances and what I might find personally interesting about the data. And so I always try to take a step back and remember what the main message we're communicating is and to center the needs of our audience. And these air quality alert social media graphics are a really good example of the tension between communicating the main message versus communicating the data. So for air quality, if you don't know, there's an air quality index that assigns a specific score based on the level of air pollutants. And if it's above a certain number, it can be harmful to health, and we might issue an air quality alert. But ultimately, when working on our social media graphics, we determined that the specific number was not as important as the message that you need to take action to protect yourself from unhealthy air. And it was much simpler to communicate that call to action and the message that the air might be harmful to your health than it would be to include the number, explain what the number means, and then get to the air quality alert and the actions that you need to take. And we felt this was particularly important for social media, where we only have a moment to capture someone's attention. Another example is this infographic that was created for family-based childcare providers to introduce them to environmental contaminants. So there's a lot of information about environmental contaminants and a lot of data about the health risks of contaminants, but it would be really overwhelming to somebody who's not already familiar with them. And this could be the first time that a family-based childcare provider is hearing about some of these contaminants. We also had the additional challenge that some of the contaminants are regulated as a licensed childcare provider and some are not, and we didn't want to get into the details. And so ultimately, working with our toxicologist and program manager, we came up with this infographic that would help the user easily understand some of the most common environmental contaminants and where they might be found in the house. And we have two sets of keys. So the blue-green color coding indicates if the contaminant might already be present in your house, or if it's something that you need to avoid introducing. And then there's a series of icons on the right-hand side that help point the end user to additional sources of information. So we've indicated if the contaminant is something that is regulated or there are requirements about, if it can cause health problems, or if there's an additional action that that provider needs to take. So again, we're pointing them towards sources of additional information instead of trying to accomplish everything with one communication material. So when I have finished creating a visualization with the team and before we publish it, I like to ask myself this series of questions and see if my visualization can answer them. So what is the main point of the visualization? Does it make sense? And why does this topic matter? If the visualization can't answer these questions, sometimes we go back through the review and revise process to improve it. And sometimes we look to add additional context to the visualization. And there are many strategies for adding context, but two of them are adding narrative or adding images. So adding narrative to a data visualization can help answer that so what question. This is where we can weave in a call to action. It can improve the understanding of the information that is presented in the visualization. And this is a great opportunity to address the differences in familiarity with the content and in literacy, differences in literacy levels in your audience. Adding images to a data visualization can reinforce and illustrate the concept by actually providing a picture. And so combining data and images can add to the meaning. This is that same heat mapping graphic that we looked at earlier. But here in the report, the developer included images from Google Street Maps of what roads in these communities or what areas in these communities actually look like. And I think it's really powerful when you can see for yourself and draw your own conclusion that the areas that are warmer have more roads and more buildings and more infrastructure and fewer trees. And this allows the user to draw their own conclusion about the environmental conditions that are creating these urban heat island effects. And again, it's much more convincing and has much longer staying power than if we told them that that was the case. So when possible, I definitely recommend including images where they make sense. But when you're looking to add narrative, we need to start with crafting a clear message, which means that we're explaining the data in simple terms and using something called plain language. If you're not familiar with it, plain language aims to help the audience understand the writing or the material the first time they read or hear it. It's writing designed to ensure the reader understands as quickly, as easily, and as completely as possible. And there's lots of resources on plain language and plain language training that you can find. In public health, we can't always avoid a technical term, although we should try to, but especially in my world of environmental health, sometimes you just can't avoid them. And in these cases, it's best to define the term, again, using plain language, and explain what it is or why it's being used. When we can, it's best to avoid jargon and really get specific about what you mean. And then taking a step back, I also encourage you to reconsider the flow of information you're presented. Academically and scientifically trained audiences tend to present background information first. This is often how we're trained to do so and we're graded on in school. But when we're communicating with an audience with limited bandwidth or maybe a lack of familiarity with the context, it's important to present the most important information first when you can, and then to weave in the background to clarify the message and add context. And I just wanted to share a couple of resources that I have found particularly helpful. So the first is plainlanguage.gov, which houses a ton of resources on how to write in plain language and evaluate what you're creating. The SMOG index, which you can Google and it will bring you to the website, is a really helpful online tool where you can copy and paste your writing into a box on the screen, and it will estimate the reading level of your writing. And so you can use that to bring writing level down from an undergraduate level to that 5th or 6th grade reading level that we really want to be targeting. And the CDC Clear Communication Index is just another really helpful tool for creating clear messaging and materials. Part of creating a clear message is defining the call to action. And I find that at the heart of health promotion and risk reduction, we want to catalyze our audience to make that decision or take that action that is going to protect their health. This call to action can be integrated into our narrative. It answers the question, what can I do or what should I do? And it's really helpful if we give the audience options. I think we all know in the US that personal choice is really important to people. So not simply telling them what to do, but providing them the information they need to make a choice about what they are going to do is really helpful. And of course, in public health, we're often dealing with uncertainty, which can be very challenging and difficult to communicate. It's particularly challenging when you are trying to instill confidence in your audience. But it's important to start by stating what you know and being very clear about what you do not know, even though that seems a little bit counterintuitive. This is part of being transparent, and acknowledging this uncertainty can actually help build trust in our audience. I find it helpful to explain why the uncertainty exists. Some people will find that level of detail and information helpful. And it's also really important to set expectations for if information is going to change, what information might change, and when or why it might change. And this is a case where the call to action can give the audience a sense of control that's really important when anxiety might be high. And I'll just give a shout out that the Public Health Communications Collaborative has this fact sheet on the CALM approach that recently came out and is really helpful if you're looking for more information about communicating during times of uncertainty. So determining what level of detail is appropriate for your audience is really important. I'm a details person. I like to be in the weeds and the nuances, but not everybody does. And the bite snack meal approach is a content strategy that was introduced by Leslie O'Flavin in 1997, and it's incredibly helpful. It breaks down content into 3 categories based on the amount of information that's being presented. So the bite is a short message communicating one point. It's a headline or 1 or 2 sentences. If you've spent a lot of time communicating, you might think about it as a tweet. So we're very limited in the information that's being presented, but it's just enough to communicate what you want to say and why it matters. A snack provides a brief summary of the information. It provides some context or details. It kind of builds on that bite, and it might be 1 or 2 paragraphs. And then the meal is the full in-depth material. This can include background, it might include methods, it has lots of detail and information, and it might be something like a report or article. And not all of these content approaches are going to be appropriate for all audiences. So if we're thinking about it from that plain language perspective of being understandable and easy to use the first time you read it, the bite might be most appropriate, especially if your audience is not familiar with the topic. The snack is a really good approach for somebody who's influential in the community, who might be able to share what they've learned with others and is ready for a little bit more detail. And then the meal is for our deep divers, those people who want to go in the weeds and want the details. So I'm going to walk through some examples of how we have used this approach from a partnership with the American Lung Association on air quality. And when I started working with the American Lung Association in 2022, air quality, especially in the Northeast, was largely considered an environmental concern. And we wanted to develop materials and messaging that brought the health impacts of air quality into the center of the conversation. So first we have the bite, which you might remember this graphic from earlier in the presentation. This is a social media post. Because we did not include the specific air quality index number, this is ready to be used without any updates. And we geo-targeted these posts to people in areas that were experiencing an air quality alert in real time. This snack has that this bite has that headline that tells you that you need to protect yourself from unhealthy hair now. And it links out to additional information with the exact data and what steps someone can take to protect themselves. I also want to take a moment to stop here and talk about the fact that we did develop these in partnership with our impacted community. So in working with the American Lung Association, we established the Rhode Island Healthy Air Collaborative, which was made up of state government partners, academic partners, but really importantly, it had membership from our communities that are most impacted by air quality and asthma. And we worked with them to develop these materials and review them before they ever saw the light of day. And their feedback was just incredibly helpful. And this bite was a really successful communication material for us. When we implemented them in the summer of 2022, these social media posts had over 890,000 impressions. And for reference, Rhode Island is small. We only have about 1 million people in the state, so achieving 890,000 impressions is a pretty significant amount of our population. They also had 3,000 clicks to the linked information, which is a great conversion. And it shows that people were really motivated to find more information about air quality and how they could protect their health. So moving on to the linked information, this is the site that we sent people to. It's airnow.gov. It includes that air quality index graphic on the left and has tips about what you can do to protect your health. This screen grab is from just a day or two ago, so our air quality was fine. But if it weren't, there would be tips on how to protect your health. Moving on to the snack. This provides a little bit more information. It's a postcard, and it was geo-targeted to people living in hot spots for asthma in specific zip codes. And so this material was targeted for people who are already familiar with asthma as a concept, whereas our bite was for the general public. This features a headline, a snack, that says that breathing air pollution can make asthma worse, and has a little bit more information and detail than that social media graphic did. And then last, we have the meal, which is our healthy air fact sheet. And this really starts to get into the details and provide a lot of information about what air pollution is, how it impacts our health, who's at risk, and kind of what's happening in the air quality research space and what we can do to make a difference for air quality. So this is really for someone who's ready to get into the details and get more information. But if you take a closer look at the meal, you can actually pull out and identify different bites and snacks. And breaking a larger material down into bites and snacks can help make complex information and topics more accessible and can help you write from a simpler and more plain language perspective. This is also a helpful way to organize information from somebody who might be skimming or navigating the document quickly, or who might not be able to take in all of this information at once, but is looking for an answer to a specific question or a specific piece of information. So again, a really helpful content strategy, whether you're creating separate materials or looking to break down a complex topic in one material. And when you pair narrative with a data visualization, it helps to tell a complete story. So for one of the programs I work with, we publish what's called a data spotlight on our website. And we take an existing data visualization and pair it with a little bit of narrative context. This is probably akin to a snack. We have a little bit of detail about the key findings, a little bit of context about why it matters, and then a call to action with a link to more information. So this data spotlight is on asthma in Rhode Island. I have another data spotlight we did that was beach closure data. Rhode Island has over 400 miles of coastline, so our beaches are very popular. And we have a program that monitors bacterial levels and closes beaches. And we found that with both of these, when we put all of the pieces of the story together and put it out on social media in our data spotlight, it actually drove the story and was picked up by local media outlets, which helps to reach a wider population than our initial visualization or social media posts would have with that really important public health information. So when we put the pieces together, data can really drive the story. On the other hand, you can also use data to build on an individual's story. Personal experiences can be really high impact communication materials. So this Providence Journal article from 2022 told the story of a family whose children had high lead levels. That was really moving and impactful. And in the article, the journalist paired this personal story with data about the broader risk of lead exposure in Rhode Island, which connects the people reading it to a broader call to action or a warning, and it helps them understand their personal risk level and may motivate them to take action to protect themselves or their family. So you can add data, you can add narrative to data to tell a complete story, or you can add data to an existing narrative to tell a complete story. It can be really powerful. And then I wanted to walk through how we have created one of our data products from idea to product to promotion. And this is the Rido Climate Change Data Explorer. It combines a wealth of climate-related data sources into a one-stop shop featuring many visualizations on different climate-related topics. So this is an example of one of the visualizations in the Explorer. This is another example featuring a map. And I wanted to talk a little bit about the assignment, which was to create an interactive data product to help people understand weather trends related to climate change and the connection to human health. And so our team was made up of a data analyst, a climate change and health subject matter expert, and a communications specialist. And we pretty closely followed that process that I outlined earlier in the presentation. So we started with the climate change expert and myself defining the scope of the project and the goal. And we used that to have our climate change expert identify the topics that would be covered in the available data sets. And then we handed this package over to the data analyst who developed the product framework and the draft visualizations. And then as a team, we took a really detailed look at the visualization and the specific formats and determined if they were the best for communicating a certain data point. And we went through with a fine-tooth comb, reviewing each visualization and the color palettes to make sure that it was clearly communicating the information, wasn't going to be easily misinterpreted, and that it was consistent throughout the data explorer. After settling on our visualization formats and the information that was going to be included, the climate change expert and I really determined that the data included were very technical and could not be simplified further. So we needed to add additional narrative context to the data visualization to help somebody who's not familiar with the data understand what was being presented. And so I'll go back a slide and just point out that at the bottom of each of our visualizations, there's a little description about what the measure that's actually being presented means. So you can see it here on our projected heat days graph, and again at the bottom of the average temperature chart. So we added this for every visualization for every topic in the Data Explorer. And so we reviewed and negotiated and edited and reviewed and repeated over and over and over. And at the end, we had published a really significant Data Explorer on climate change data. And we spent probably 6 to 8 months working on this. So we've invested a significant amount of time and resources, and we don't want that data visualization just thrown up on our website collecting dust. We pushed it out proactively through program newsletters. We announced it on social media. We featured it in the data spotlights that I mentioned earlier, which were also cross-posted to social media. But we also kept it as a resource that we could use for reactive storytelling. We got questions from journalists about climate change, and were able to provide the Climate Change Data Explorer in part of our responses. We were able to provide it to the staff at the governor's office when they had questions about climate policy and the relation to public health. We shared it with the Department of Environmental Management and academic partners, and we looked for opportunistic opportunities to join the conversation that's happening organically. So if you're keeping an eye on social media and the news, you can see what conversations are happening already and where there might be opportunities to add to that conversation. So last year, Rhode Island had record-breaking rainfall in the summer. The year before that, we had a drought. And we were able to pair the climate change drought visualization with some graphics that provided additional context about what drought is and what was happening in Rhode Island with the public health consequences of a drought. And this really helped to point out that while the drought that we were experiencing in 2022 may have been a standalone weather issue, it did connect to larger trends in climate that we had been seeing over time. And so that is the end of my presentation. Thank you very much for listening. I hope this was helpful, and I would be happy to answer any questions that you might have. And I'm providing my contact information if you have any questions that you'd like to follow up with after as well.
Thank you, Caroline. There was a question in the chat, maybe more than one. One was a question about, can you tell us some examples of mistakes that were made? At the beginning, you showed some rules and general framework for how you create these to avoid mistakes. But do you have any examples of errors that often happen?
That's a really good question. One of the most common errors that I see is not clearly stating what the denominator is in a message about data. So we might say that 7% of children in Rhode Island have elevated blood lead level, but we want to know the ages of those children, how many children were tested, like really providing a little bit more context than 7% of children. I think also not including the scale on a data visualization, which I think, there's a tension between providing a level of detail that allows someone to interpret a data visualization without providing too much clutter. And sometimes that scale gets dropped when it really needed to be included. So those are kind of the top two errors. I think the other mistake that I see frequently is just using really technical terms because we forget that they're technical information because this is what we live in day to day. So really taking a step back and asking if somebody who's not familiar and has never heard of these topics can understand them is really helpful.
There's another question in the chat. What products do you most commonly use for data visualizations? Canva, Visme, ArcGIS, Excel, Tableau?
Yeah, another great question. So two caveats to my answer to this, that I do not create the data visualizations myself, so I am not working in the tool. And because I work for a state agency, all of the decision-making processes are happening at the state level. But I can tell you that our data analysts primarily work with Power BI. They do some work with R, and there's a lot of work happening in ArcGIS.
Thank you. I had some questions too. If there's more questions in the chat, we'll answer them. But in the meantime, and you can unmute yourself and speak your question aloud if you wish as well. I had a question about the two similar graphics that you showed us about air quality. One had a bridge and one had a map. And I wondered, was the community choosing between those two, or did you use both, or what was the story there?
Yeah, that's a great question. And I didn't get into the details on this, but we actually created 6 social media graphics for the air quality alerts. We created one for each of the 5 counties in Rhode Island. And yes, there are only 5 counties in Rhode Island. And then we created one for the entire state. So the image of the bridge was actually an image of a bridge in that county that would help the graphic feel familiar and personal to the audience. And then the statewide map was for when the entire state is experiencing an air quality alert, we use that graphic. So we try to tailor the content for that project to where the person is, where the air quality alert is being experienced. But because we're such a small state, sometimes the entire state is being impacted.
I also had a question about the calls to action. I know you're big on calls to action, and I wondered if you can describe how you make a call to action that doesn't feel like, oh, here's the government bossing us around, but instead feels empowering. Any comments on
Yes.
that?
Yeah, it can definitely be tricky to create a strong and empowering call to action that is not communicating a directive. I think also a call to action, it's a little bit weaker, but oftentimes inviting somebody to just learn more and providing that link to information can be a call to action if, there's not a strong action that somebody should take. Sometimes we do include a call to action that is more of a directive, like oftentimes for our lead poisoning material, we, advise people to go and get their child lead screened. But where possible, if there's more than one option, communicating that there are choices is really helpful. So for, for air quality, there's a lot of things that you can do to protect yourself from poor air quality. You can choose to stay inside instead of going outside and exercising. You can exercise at different times during the day. And providing kind of the range of choices that someone has to protect themselves from air quality allows them to not only feel empowered about making the decision and expressing that personal choice, but they get to choose the call to action that best fits their needs.
There's another question in the chat. Any tips for working under strict comms rules? For example, in my state, we are not allowed to have our own program social media pages and have to put everything through the main state page, and they always change everything we give them drastically. We are also super limited on the amount of stuff we can send them.
Yes, we actually have the same process at the Rhode Island Department of Health, although our social media manager is wonderful. So tips I would have from a communications professional about working with a communications professional as a subject matter expert is if you haven't already, I would ask them for feedback on why they're changing what is being changed in your messaging materials. There's probably a reason. And if you feel like what they're changing is impacting the accuracy of the message, I think that there is room to let them know and have a conversation about how to get to something that is understandable, but still technically accurate. I go through this process all of the time with our engineers in drinking water quality and our food safety managers in food protection, because there's a real balance between providing accurate information on a technical topic, but also making sure it's something that can be understood. Your communications office hopefully also has a good sense of what has had maybe a poor reaction in the past. So they might be taking that lens and trying to adjust the message to something that might be received a little bit better. But I think asking for feedback and asking to have a conversation about what is being produced is really helpful. Also, because everything is going through one channel and there are often so many programs that want to share information on social media, I try to give our social media manager a heads up if there's something that's really important that I want to go out at a specific time, or if we're doing a larger campaign and we'd like to have a larger share of the social media bandwidth. There's, again, a really big balance on social media between the amount of content you're putting out and whether or not the social media channel algorithm is going to promote your content or put it lower in the algorithm if you're putting too much content out. So that's part of why they are limiting the amount of content that's being put out and giving them advanced notice before you have the material and before you want it to go out may allow them to plan better to put out a larger amount of your specific material for a specific period of time.
Thank you. Another question came in. This isn't your area, but you might have ideas anyway. What would you recommend for a call to action when talking about drug overdose? And what type of materials would be appropriate? A bite or a snack if you were working in a booth? I assume that means like a booth in a public health education in a fair or something like that.
Yeah, that's a really interesting question. And I will start by inviting you to visit our website and look at the drug overdose prevention program from our Department of Health. My colleague who does the communications for that, I think, is just phenomenal. And she actually uses data to drive a lot of their communications decision making. So you may find some resources that might be helpful in developing your own communications. It's a little tricky because I'm not sure exactly who the audience in question is, but when we're doing community outreach to the general public, I'm thinking about a bite. I want to have a quick sound bite that I can say in a short interaction that they will either walk away and think about or follow up and ask additional questions. So that might be a statistic about the prevalence of drug overdose in your community. It might be a call to action. If it's a community that's already talking about drug overdose, if you're at an event that's focused on drug overdose prevention, you might be focused on some of the actions that somebody can take to help solve the problem, whether it's, having naloxone on hand and the availability of those types of trainings, or how to recognize the signs of an overdose. I think providing the action that is going to allow somebody to feel like they might be able to help solve the problem would probably be a good start, but definitely outside my area of expertise.
Thank you, though. I think that's a helpful answer. Could you say again what website to go to?
Sure. So the easiest thing is probably just to Google RIDOH, RIDOH, and drug overdose prevention, and that will bring you right to the webpage that would have all of the different publications and materials that program puts out. They're also very active on our social media channels. So if you look for the Rhode Island Department of Health Facebook or Twitter page, now X, that would also be a place where you can see some of their communication materials.
Thank you.
Sure.
There's just 5 minutes left, but you don't have to spend all 5 minutes. But I was wondering if you could go back to your Climate Data Explorer slide.
Sure.
And talk about that a little bit. I know a lot of people are interested in dashboards, and I thought that this was interesting and had some, stuff that's better than dashboards.
Yes. Yes. This started as a dashboard assignment, and this is where we ended up. And I have to give so much credit to our data analyst who did such a phenomenal job and worked really tirelessly on this product. So Carol, are you interested in kind of an explanation of how this Data Explorer works, or more about the process?
How is it different from, what did you add that a dashboard doesn't have, kind of, and why? You did talk about the process some already.
Yeah. So I think a little bit, the naming between a data explorer and a dashboard probably is a little bit semantics. We really wanted something that an average person would feel comfortable navigating, that you wouldn't need background in data to understand. So there's a homepage that explains how to use the Data Explorer, first of all, that is not being shown on the screen. And it tells you that you can use the buttons on the left-hand side to navigate the different topics. And when you click on a topic, you go to, again, another kind of home screen that explains what the topic is, how it relates to climate change and health, and gives a preview of the types of data that are going to be in each of those pages. And then the row across the top of the graphic has, or the top of the Data Explorer has each of the different measures that you can look at. And when you click on each of those, it brings up the data visualization. Some of them are interactive and you can click between different filters, and they all have that little context at the bottom. I think from what I have seen, dashboards tend to have maybe notes at the bottom, but I think most of them are really missing that narrative piece that is going to help somebody who's not familiar with the data already understand what they're looking at, especially if they don't have a background in data, creating data explorers or creating data visualizations and interpreting data. So hopefully that helped answer your question a little bit. And on the next slide on this map, you can actually see where you can toggle. These aren't quite filters, but there were different years of data available, different threshold for what a day above, if you wanted to look at a day above 90 degrees or a projected day above 95 degrees, and then different emission scenarios. And they all kind of changed the data that were being presented. So this one's a little bit more interactive. There is a question that I was messaged about if the slides will be shared, and I'm definitely happy to make them available. I don't know if anybody has a final question in our last minute here, but thank you so much for joining me this afternoon. Again, happy to take a final question or to connect over email.
Many thanks are in the comments. So again, thank you, Caroline, and your time with us. It was a great presentation, and we hope that everyone was able to take some pointers and tips and tricks for data communication in addition to the visuals. It's about our words as well. So thanks, everyone. I will follow up with the recording once it's available, and if Caroline permits, her slides as well, and a short evaluation too. So thank you, and have a great Tuesday.